COVID-19 could be authorized within the next weeks or so. So here to answer our questions tonight is Dr. Robert Finberg, professor of medicine at UMass Medical School in Worcester. Doctor, it's always great to have you with us. This new candidate from Johnson & Johnson uses that single dose, doesn't require special refrigerators. You sit on the governor's vaccine advisory board. If the Johnson & Johnson vaccine receives authorization from the FDA, does it change, and how could it change the state's rollout plan?
So another 100 million doses going to the country by June, which is what Johnson & Johnson is promising, would be great news for us. The state's vaccine program has been limited by the available number of doses that we can get. So getting that will allow us to get it to more people and move it to the general public faster.
Doctor, I got a text from my best friend this morning, and she said, can you ask the doctor this question? So I'm going to ask you this question. Why is the rollout divided into age groups? If the virus spreads randomly, wouldn't the state do a better job slowing the spread if it vaccinated people at random as well?
Well, no. The virus doesn't probably spread randomly, but the virus actually is much worse on old people. The chances of getting hospitalized or dying when you get COVID-19 when you're over 75 are dramatically more than younger people. If you're between 75 and 84, you're 200 times more likely to die of COVID-19. And if you're over 85, you're 600 times more likely to die of COVID-19.
Those are sobering numbers, Doctor. So, as you know, phase 2 for people 75 and older started on Monday. And certainly you've heard about the confusion and the complaints. We have reported on them here since they started. So what do you think the state needs to do better as more people become eligible?
So the state needs to get a better sign-up plan, a way for people who do not have a lot of technical skills to sign up. Also, and I know the Department of Public Health is working on this. We also need to set up sites that people can get to. And I know that vaccine sites are being set up across the state. So that's what the state needs to do. And the state is working on that, I believe.
And Governor Baker said today that some minority communities have been more reluctant to even get the vaccination. So what do you think has been the biggest barrier in that case?
So there's a terrible history in this country of minority groups being subjected to experiments that they had no knowledge of and were not willing to do. And therefore, it's not surprising that there is reluctance in communities. So what I believe the state, and certainly those of us in the medical community, are doing is to get the data out that this is not an experiment that we're doing to people. These vaccines have been tested in volunteer groups, willing groups, in both majority and minority groups, and they are safe and effective. And we believe if we can get the word out, that will change people's minds and they will get the vaccine.
Well, right there in front of them, Dr. Finberg, you've gotten both, and you are right here chatting with us about it.
Right, and it was the right thing to do, and I'm very happy about it, and hope that all will take advantage of this opportunity. We want to get it out to all the people that need it.
Right. Dr. Finberg, thank you for your time.
Thank you, Doctor.
Stay
well.
Weekend.